As Mr. Sarbanes for 5 minutes for questions.
Thanks very much, Mr. Chairman. Secretary Becerra, thank you for being here, for your work and the Biden administration's work to protect and expand access to care and to lower costs for Americans, especially as you talked about prescription drug costs for our seniors. I want to discuss how this year's budget request provides some strong investments in a few particular areas, the first being our healthcare workforce. Like many on this dais, I've heard from providers and patients alike. You've certainly been hearing it about the very real challenges our healthcare system is facing as a result of tremendous workforce shortages that span every level of care. This year, I'm proud again to join with Representatives Blunt-Rochester and Representative Schreier in urging robust funding for HHS's National Center for Health Workforce Analysis, which, as you know, provides critical high-quality data about supply and demand issues and oversees 9 research centers that provide technical assistance to regional and local groups. Can you discuss why investing in comprehensive data collection and analysis initiatives like this are so vital to understanding the full scope of the workforce challenges we face and ensuring that we make the right policy choices to address them?
Congressman, because we know that too often the workforce goes where the money is, and unfortunately some of the deserts, healthcare deserts that we have that are desperately in need of more workforce won't get them. It might be rural America, it might be low-income America, and what we want to make sure is that we have the data that help us determine where we need to make sure that future healthcare workforce goes.
Thank you, and it's a smart investment. I've long believed that we can encourage individuals to pursue public service or other careers that may be paths less traveled for any number of reasons: lower salaries, what are perceived as less ideal geographic locations, et cetera, through programs that offer loan repayment assistance to those who commit to these positions for a given time. That is why I authored the Public Service Loan Forgiveness Program and helped create the STAR loan program for substance use disorder providers. It's also why I'm such a strong supporter of the National Health Service Corps. Can you briefly speak to the investments this year's budget makes in helping relieve the student debt burden for critical primary and behavioral health care providers?
The budget, and thank you very much for your support, Congressman Sarbanes, over the years for this program, has made it possible for us to send thousands of healthcare professionals, doctors, nurses, others, into the field and helping mostly underserved communities. And my son-in-law, who is now a pediatrician, is one of those graduates of the program. He got his 4 years of medical school paid for, and the result is now he owes us 5 years of service in an underserved community, and that's exactly what he's doing. By the way, he applied for that program way before I became secretary, so just so there's no confusion.
So the record is clear. Yeah.
It works. It really works.
Yeah.
There are some 19,000, I think, slots that we have to put the healthcare workforce out there. These are people who may not have otherwise had an opportunity to graduate and become the future doctors. So it is absolutely a great investment, not just for those people like my son-in-law, but for Americans who end up having a great pediatrician to offer services to their kids.
Yeah, let me punctuate the point you just made. It obviously helps those individuals fulfill their career aspiration, but it's more so what it does for the country, and that's why we support programs like that. It's critical that the pipeline that we're talking about right now be robust, particularly given the mental and behavioral health care crisis we face, especially among our youth. More data every day that supports that unfortunate circumstance. I've also long been an advocate for strong funding for school-based health centers. As you know, we've talked about this before, which meet children where they are at school to deliver care in a trusted setting. This year's budget includes robust investments, I see, in community health centers and their related programs, and increased funding for several youth mental and behavioral health care initiatives. How do you believe these investments can work together to ensure every child has access to treatment and prevention resources, as well as, should they need them, more acute crisis care interventions?
Congressman, as you know, there are a lot of phenomenal community health clinics out there in our communities who would love nothing more than to be able to reach into the schools to provide care directly, but they need some support. We put out about a $25 million grant proposal out there for a number of organizations to apply to help stimulate their interest in making that arrangement with schools. Today, we see far more young kids having access to health care through their schools. We want to continue to build on that. We're working through the Medicaid program to help schools qualify to actually get Medicaid reimbursement dollars directly into the schools, because we think the best place to offer a child who's, especially low-income child, health care is where they are 5 days a week.
It's a no-brainer. Thanks very much. I yield back.
Thank you. Gentleman yields back. Chair recognizes Mr. Latta for 5 minutes.